We got questions for the sponsor before we start bringing the public up. Representative Hammer, you got a question for the sponsor?
Thank you, Mr. Chair. Representative Bentley, I recognize, or I saw in the bill that this is going to be subject to the Secretary of the U.S. Department of Agriculture. Has this been done in another state that we know that this is going to be able to get past that approval process?
Maine has got theirs, someone has gone through, went a different route, and the reason that I did not bring this up, because I feel like we have change in leadership going on. Representative Hammer, with our new president coming in, I think we'll have new director of USDA, and I'm hopeful at this point that yes, we will be able to get this approved. It's common sense legislation. I think we have a common sense president coming in, and I'm hoping we will have a common sense USDA director that will help our state to move forward.
So, follow-up.
Right now for one follow-up.
Thank you. So we wouldn't be the pioneer on this project because somebody else is already doing it out ahead of us. Is that a fair statement?
I think we have seen other states do it in different directions. Like I said, Maine has a legislator in Tennessee just filed a bill this past week as well for junk food. I think this new report that came out, Representative Hammer, showing that soft drinks were the #1 purchase of food stamps, that we will see legislation across the nation as ours is. And I'd love for us to be a pioneer and do things for our state.
Question for the agencies on the bill.
Okay, we'll put you in the queue for the agency. Representative McGee, do you have a question for the sponsor?
Thank you, Mr. Chair. Representative Bentley, first of all, I want to applaud you for helping us raise awareness about obesity and the health issues that it creates for our state in terms of diabetes, hypertension, and all the long-term problems. But
Representative McGee, can you get closer to the mic, please?
it's here now.
Okay.
But my question is if we do this, is this not going to be an unfunded mandate on our grocers? I mean, how are we going to enforce this? They're going to have to develop new computer systems in their stores to keep people from buying these things with their food stamps, or how will that all be enforced? And I've got a lot of comments from the grocery industry that they really don't like this.
I appreciate your question, Representative Hammer. I'm a manufacturer in Arkansas, and I deal with UPC codes every day. And every item in that grocery store has a UPC code. And you can simply go in there and stop those UPC codes from being funded. Right now, we can't use it for alcohol, we can't use it for tobacco, we can't use it for anything. It's a non-food item. So we have UPC codes for a reason. That's the very reason that we have. And I don't think that we should say because a government program is too big that it's too big to fix. We can fix this program. That's the reason we have UPC codes, and I deal with UPC codes every day on a daily basis at my business, and they can do the same. And I understand I also have government contracts. We've done government contracts before, and government contracts are a pain in the neck. They're a lot of paperwork, but in the end you make a bunch of money, and they've been making a bunch of money. And I understand it'll be an inconvenience, and I understand that it will be an education for their tellers to have to deal with a few, they'll probably have some uncomfortable situations at the teller for a little while. I understand that, but the point is we have a serious problem. And do we want to get above 48th in our nation? Do we want to stay down here with poor health, or we want to be the first for a change to make a real difference? I want us to be the first and make a difference.
Thank you, Mr. Chair. That's all.
Thank you. Representative Henderson, do you have a question for the sponsor?
Thank you, Mr. Chair. I guess the only thing I'm really looking at is maybe, is there a financial impact, or have you done a financial impact statement?
I don't see there's going to be any financial impact for our DHS to apply for a waiver to CMS.
I would kind of think that anytime we implement a program like what you're talking about, there has
Representative Henderson, can you get closer to the mic for me?
anytime that we implement a program like that, I would just think it would be some kind of physical impact.
The adjustment will be with our grocers. As far as the state, we're going to apply for a waiver from CMS, and I don't see any financial impact to the state of Arkansas.
Okay.
Representative Pilkington, you're recognized for a question.
Thank you, Mr.